Hi, my name is Amy Riedel, and this is my intradermal injection video. So what I'm going to need for this injection is a 1 ml syringe with a 25 gauge needle and 5/8 length. My medication, in this case, it's going to be tuberculin, and a gauze or cotton ball, gloves, hand sanitizer, and my patient or my arm, which is what I'm going to use today. So to start off with, I'm just going to verify the provider's order. So we're going to be doing tuberculin 0.1, which is 5 TUs. So we'll be drying up 0.1 mLs. And I just want to verify that. And this is a multi-dose bottle, so we'll definitely need to write the date and time we open it, because most of the time it's disposed of after 30 days, or each medication is kind of different, so you want to check on that. Okay, and then after we verify the orders, we want to just make sure we have the right dose, the right route, the right patient, the right medication, the right documentation, the right time, and the right patient. So we just want to make sure we have all those 6 rights and head to the patient's room. So we're just gonna go ahead and knock on the door, introduce ourselves. My name's Amy Riedel. I'm gonna be doing your TB test today. So I'm gonna just close the curtain or the door just to give you some privacy. Also, I wanna get your name and date of birth and check for any allergies to medications or anything. And once I verify all of those, I'm going to go ahead and start preparing the medication. And while I do that, I'm just going to explain the procedure to the patient. So we're going to be doing a intradermal injection on your forearm. And we'll just make a, that's about 5 mms to 10 mms. So just a little bump that looks like a mosquito bite. You want to come back in 24 to 48 hours to have it read, just to make sure there's no reaction. Some side effects to watch for is fever, blisters, hives, dizziness, fainting. So just watch for any of that. You may have a little bit of bleeding. And you may feel a quick pinch and stinging and burning when I enter the needle. So from here, we're going to go ahead and start drawing up the medication once I perform my hand hygiene and open up my alcohol and wipe the top of the bottle with a piece of alcohol. And I'm just going to pull back some air into my needle. So we're going to do 0.1 mLs. And then I'm going to just go ahead and push that air and inject that into the bottle and pull up 0.1 of the medication. And I'm just gonna kind of get some air bubbles out here. Perfect. And so I'll just let him know with my non-dominant hand, I'm gonna do like a C. Sorry, I'm just gonna pull this back. A C. And before I do that, I wanna make sure I clean the patient's arm with alcohol. I would wanna be careful with this, not to poke myself. So just from the inside out, and just give it a moment to dry. And once again, just remind them some burning or stinging. So we're gonna go ahead and make our C, and then with the bevel up at a 5 to 15 degree angle, we'll insert the needle. So you just wanna be right under the dermal, and slowly go ahead and push the solution in, and hopefully get that weld that's 5 mms to 10 mms. And go ahead and give him a cotton ball if it's bleeding. Notify him you don't want to put any pressure on it. It's okay to just dab off some of the blood. You don't want to rub it or anything, and to just watch it. And you're going to make sure you don't do it on any area that already has lesions or any rash on it. And then make sure you cap your needle and dispose of this into the sharps container. And go ahead and clean all this up and document the procedure, document the arm and where it was placed, and have the patient return to have read. Awesome. And then also make sure you remove your gloves and do your hand hygiene, of course. And you should be all set to go. Thank you.